Hello, my name is Nora Super, and I'm the Senior Director of the Milken Institute Center for the Future of Aging. Today, we will be exploring a very important issue impacting people across the globe, building mental health resilience amidst uncertainty. Behavioral health conditions consisting of mental and substance use disorders have societal, economic, and healthcare system implications, all of which are amplified by the COVID-19 pandemic. 1 in 5 US adults experience mental illness each year. When I conducted sessions on mental health in the past, in live sessions, in-person sessions, I used to look around the table and say, look around the table, 1 in 5 people at your table are experiencing some sort of mental health condition right now. Now that we're all living in a Zoom world, I ask you to look at your Zoom gallery views and understand that as well. It's among all of us, and many of us are experiencing mental health stress during the pandemic across a wide spectrum. According to a Kaiser Family Foundation poll, nearly half of US adults have reported COVID-19 has negatively impacted their mental health. In June, the CDC reported that 40% of adults in the US have struggled with mental health or substance use associated with the COVID-19 pandemic. Younger adults, racial and ethnic minorities, essential workers, and unpaid caregivers of older adults and people with disabilities reported having experienced disproportionately worse mental health outcomes, increased substance use, and elevated suicidal ideation. The workplace and communities are poised like never before to provide much needed resources and support as many individuals grapple with a host of experiences, including fear, anxiety, stigma, isolation, and hopelessness. We're going to talk about all of these issues today, and most importantly, strategies on how to provide better support to individuals who are struggling today. With us today are 3 extraordinary leaders who have stepped up to address this challenge. Deborah Lafer Scher, who serves as the Executive Advisor to the Secretary, Center for Strategic Partnerships at the U.S. Department of Veteran Affairs. Brian Niccol, Chairman and CEO of Chipotle Mexican Grill, and Roger Krone, Chairman and CEO of Leidos. Thank you all for being with me today. I'm going to start with you, Deborah, and ask each of you the same question. All of you are leaders in building mental health resilience for your employees or constituents that you serve. What propelled you to become a high-profile leader on mental health issues?
So Nora, thank you for having me here today, and thank you for including the VA in this conversation. The audience may not know that the VA takes care of 9 million veterans, and we take care of them from the time they leave the service to the time they leave this earth. And so we are passionate about prevention and driven by healthcare outcomes. And even before COVID, we believe our responsibility is to take care of the whole person, their physical health, their mental health, and their emotional well-being. Everyone knows that war can have tremendous lasting impact. And so the VA has offered 1-year free mental health counseling to anyone who has served in the military, regardless of their discharge, regardless what level of care they're eligible for at the VA. And we believe it's so important to reduce the stigma around mental health and to open the conversation so that we can all support each other and help each other, that the VA has done whatever possible to be out in front in this conversation, including building partnerships and coalitions with the private sector, with some of our colleagues who are on this panel with me today, to try to strengthen the mental well-being of veterans and all Americans.
Thank you, Deborah. You mentioned partnerships with employers, and we know employers are in an important position to really help people who may be struggling with mental health issues. Brian Niccol, when we normally think of Chipotle, we think of excellent burritos and tacos, but we don't normally think about mental health awareness. What made you want to address this issue?
Yeah, well, Thanks for having me on the panel and to be a part of this conversation. Uh, Obviously, we have a large workforce, so we've right around 100,000 employees, and we wanted to make sure that we were providing the right support and benefits so that folks could do their job and obviously be positive forces in their community. And one of the things that stood out to us was that there was no mental health program in place. So about over a year or so ago, we decided to put in a program that gave all of our employees access to a mental health program, not just themselves, but also their immediate family. And what we found is this was one of the top needs that people had. And the utilization has been tremendously high. And folks are just so grateful, not just for themselves, but also for their immediate family to have access to it. And what we've seen is it just creates a place that people then want to be working. They focus on building our culture. And it's very much consistent with the values that we talk about, which is we want to be investing in our people and we want to do it in a way that cultivates a better world. So, when we saw the need, we wanted to step in and fulfill that need. And, to date, the feedback has been very positive. And then obviously for the individuals that are taking advantage of it, it's been really life-changing.
Great, thank you. And Roger Krone, let's get you into this discussion. Leidos is a recognized global leader in solving important problems in the defense, intelligence, homeland security, civil, and health markets. What caused you to become engaged in mental health, substance use disorders, and the opioid crisis response as a CEO?
Great. Thanks, Nora, and to everybody out there on the web. Thanks for joining us. This is a really important topic. Leidos, we're a 50-year-old company, and for the first 40 years, we were employee-owned. And so we have this huge empowerment culture, and we do most of our work through our 40,000 or so employees. And our journey started around opioid and a drug addiction. And like so many things at our company, it started with an employee and an email. A fellow named John Heineman, who works out of Pittsburgh, had a son who he lost to opioid abuse. And he sent me an email, 3 years ago, maybe longer than that. And it was a father's story. And he talked about the difficulty he had with his son and Oxycontin and being on and off and using naloxone. And then at some point he actually succumbed. And about a quarter of our revenue is in the healthcare or healthcare related business. We do electronic healthcare records. We do that for the military. We support veterans across the board, a big supporter of the Veterans Administration. And John said, well, what are we doing about it? This is a huge issue. Up to 70,000 people across the United States overdose on time-released morphine. And I couldn't answer the question. I didn't understand the issue. It had not been something in my family and my relatives. And so we did a lot of research. We polled our employees, and that really kicked off our anti-opioid program. But over the years, that has really opened to the broader issue around mental health. Is drug abuse has a lot of its basis in mental issues. And then as of late, we've added really a third pillar to our program around COVID-19 and what that has done to the stress of our employees and the communities in which we serve.
Great, thank you. Let's talk a little bit about depression. Depression is estimated to cost 200 million lost workdays each year at a cost of $17 billion to $44 billion to employers, according to the CDC. Depression is a major cause of disability, absenteeism, presenteeism, and productivity loss among working age adults. So this issue is deeply personal for me. I had 3 episodes of major depressive disorder throughout my career, and each time I was unable to work for at least a month. Luckily for me, I've recovered, But you've all mentioned the need to care for your employees and make sure that they're well as a caring employer, but it's also an economic issue, isn't it? Have you looked at this, for example, on how it may be affecting your absenteeism or presenteeism and providing that mental health support, specifically when we're dealing with this pandemic?
I'll go first here, and we can pass it off.
Sure.
In actuality, it's been less about the financial side of it for our approach on this. It's been more around the idea of we think it's the right thing to do. Clearly, you find people miss work, and they obviously aren't their best self when they're dealing with something that's unsupported or undiagnosed. But I think the economics behind it, we kind of always knew in our head would make sense. When you have a healthy employee, you get better outcomes on all different levels. It hasn't been really a driver for why we've chosen to act on this. What we just believe is, in the end, we got to have great people, we got to have healthy people, and there is a need out there right now on this mental health aspect that we knew we could step in and fulfill. So I'm not surprised by your numbers, but I would tell you the numbers weren't the driving force in our case. The driving force was just, it's obvious. A healthy employee is a better employee. And then they're also a better family member, a better community member, and it just cascades from there.
Great.
Yeah, Nora, our emphasis on mental health followed very much the same journey. It really started with how can we make our employees healthier? How can we make them better both at work and at home? By the way, we like to think we send our employees home at the end of the day, perhaps even healthier than they came in the morning. And so we're a data company. We've done a lot of data analytics around our clinical data. And one of the early things we realized is that most of our costs, somewhere around 60% of our healthcare dollars are spent on preventable diseases: high blood pressure, smoking, drug abuse, depression, mental. And so then we're engineers, so we broke that down. We said, what is it about our health plans that are not addressing some of the fundamental issues that cause our employees to, incur stress, for instance, in the workplace? And we found out it wasn't, having a job is important, financial security is important, mental wellness is important, and we were providing a medical benefit. And we kind of came to the conclusion that we weren't providing the whole benefit. And so we added financial planning as a benefit for our employees, because when they can do financial planning and they know they are financially and their loved ones are financially secure, it reduces the level of stress. We added mental health and wellness to our benefits package, so they had a place to go. We actually subscribed to an app where our employees can download it on their cell phone. They carry it around with them. We also found that, especially in COVID-19, childcare and family care was important. And so we extended policy that we have on emergency childcare, where we doubled the number of days that one can use this. It's sort of like a lifeline. If your caregiver is sick, you can call this provider, and you can get, on very, very short notice, childcare, because if your family's taken care of, that reduces the stress on you. And what we found is it actually has a benefit. You're healthier, you have less of these chronic illnesses. And although there's an economic benefit, we really, like Brian, did it more because we just want our employees to be healthy. We want them to live, a complete and fruitful life.
That's great. And I think that as we do look at what's happening during COVID, and certainly research that we've done on workplace wellness, these issues that you raise are so important, especially during COVID. People are worried about job loss. It might not be themselves, but family members that, have lost their jobs, and certainly caring for kids that are home, or also in trying to maintain your job, or caring for elderly parents are all issues, and figuring out how to make the finances work. I want to turn to stigma a little bit. This is something that we talk about and think about a lot in mental health, and it is a challenging topic for us. So according to U.S. Surgeon General Jerome Adams, he said, one of the biggest killers out there is stigma. Stigma keeps people in the shadows. Stigma keeps people from asking for help. Stigma keeps families from coming forward and asking for help. So, you all have all been leaders in addressing this. One of my reasons for coming forward and being more open about my own mental health struggles is, after Anthony Bourdain and Kate Spade died of suicide, the people came out and said, they're so successful, had everything going for them, why would they take their own life? And for me, it was that people don't really understand depression or some mental health disorders. Also, that many people hide their illnesses because they're fearful that their employers will find out, or they might lose their security clearance, for example, or really have some challenges of people thinking they're weak, rather than recognizing if you seek help, you're actually doing better for yourself and your family and your employer, as you all recognize. Shatterproof has highlighted that drug overdose is the leading cause of accidental death in America, yet nearly 9 out of 10 people who need help never receive treatment. And when a person with substance use disorder has internalized a negative stigma of the disease, it directly damages that person's chance of recovery. So I just would throw it out to each of you. Maybe Roger, you could start just to talk a little bit about stigma and how you think some of the employer provided benefits that you all have has tried to reduce that stigma.
Listen, I couldn't agree more that stigma is a huge problem. I have a classmate of mine from college who was in the military. I've known him for 42 years, and his son actually passed away from opioid abuse. I've known him for 42 years. His other son went to the Navy Academy. I knew him quite well. I never knew that his son had an addiction problem, and it's the stigma. People don't talk about it. Families don't want to share it. What we've done is at Leidos is we've tried to push it out in the open. I try to set the tone from the top. I talk about it a lot. We have organizations within the company that people can go to if they have an addiction problem. We support a lot of the community awareness organizations, CADCUB, a lot of the local organizations that give people with a problem a place to go. Our company is about 30% veteran. We find the concern and the stigma to be maybe heightens among the veteran community. If you're a soldier, you're used to being out on patrol. You're kind of an alpha, and if you're using maybe it starts with a painkiller and then it ends up with an opioid, that's a sign of weakness, so they don't tend to share it with their buddies. And then as they transition to the workforce, often they bring it with them. And same thing with mental health. And the concern, and Nora, you mentioned it, is there are some rules depending upon what you have to disclose. There's this thing called a security clearance you typically have in the military. It's a valuable credential that you bring with you into the workforce. And if you seek counseling, there is a concern, by the way, it's not actually completely true that you would lose your clearance if you sought counseling, but there is a stigma that is, if I seek help, I put my security clearance at risk, and therefore I put my employability at risk. And so what we have tried to do is to create safe harbors, places where people can go. And frankly, because of some of the HIPAA rules and the privacy rules, I don't have any insight into our employee base of who has sought counseling and who has had an issue. But I think on the broad stigma, the more everyone talks about it. And CEO on down, we've funded some public broadcasting specials. We did a piece with Mark Wahlberg's brother that aired on cable TV. The more people that talk about that I had a problem and I recovered, and the more that is known to be more common, I think the more we will get at the problem of stigma.
Yeah, that's so important. And I raised the issue. I worked at the White House earlier in my career, and, you do have to go through FBI clearance, get a lot of security clearance. So I know this concern is shared by many people in the military, as well as people, in high profile positions. And my brother-in-law actually works for a defense contractor and has been afraid to get mental health treatment because that his security clearance might be done. But then I think and try to counsel him, like, you'd much rather be getting treatment than have, and I think from an employer's perspective, than having employees that are unstable that aren't getting treatment. So it's one of those challenges. You mentioned the veterans and all of this. Deborah, I know this stigma issue is something that you all deal with in the VA and are trying, to come up with solutions for veterans to get help wherever they can.
Yes,
Want to talk about that a little bit?
I'd love to do that, Nora. Thank you. So we had 1.7 million veterans in mental health counseling last year, and we are trying to open up the conversation to reach veterans wherever they are. And I think you raise a really important point about how the workplace is really changing in the last couple of years. And Nora, I think it's people like you who have raised this conversation so publicly that has made a difference. I'll just give you an example. The veteran suicide rate, well, the country has a crisis around suicide. Suicide rates are skyrocketing. There are tragically a growing number of very unhappy people in this country. Veterans, is a component of that, but it's certainly not the whole story. And I think Roger's right. There are veterans who are trained to not talk about mental health issues because it's a sign of weakness. So we are working very, very hard to change that stigma. One of the new programs we implemented last summer was we looked at the veteran suicide statistics, and there are on average 20 veterans a day die by suicide annually. And that number has kind of been stuck, even though there are some very aggressive programs, proactive programs around this issue. And so we started to think about, as you peel back the onion, 60% of those 20 have no contact with the VA. And so we started to think about where they are and realized, as Roger has so clearly given an example, that a significant component of them are likely in the workplace. And so I approached the president of Hiring Our Heroes, which is a division of the U.S. Chamber of Commerce made up of some of the largest employers of veterans in this country, and said, we would like to build a coalition with you to strengthen employee well-being in the workplace, to prevent veteran employees and civilian employees from ever going down the path of suicide ideation. And Nora, when I approached him, I was not sure that this was an issue that employers were interested in embracing, because several years ago, I don't think anyone would have wanted to have a conversation about that with us, certainly not about suicide. But Eric Eversole, the president of Hiring Our Heroes, responded instantly, and he said, this is an issue our employers care about, and they will want to help. And so we convened a small working group of 10 employers to try to figure out what are best practices, what's the right way to galvanize all of the employers in America around this issue, and how do we do this effectively? How do we reduce stigma? What are the programs that make sense? And we learned about some tremendously innovative programs that were going on in the workplace. We also heard some very heartfelt confessions from people who are in charge of massive programs in these large companies who said, we have been struggling to make a difference to strengthen employee mental well-being in the workplace, and we're not sure we have it right. And so there were people operating in independent silos in these organizations who jumped at the opportunity to be together with their peers and to figure this out as a coalition. And so by November, we had built a coalition of more than 30 significant sized companies representing more than 6 million employees whose employers, CEOs signed this pledge and publicly had a signing ceremony in front of Secretary Wilkie to strengthen employee mental well-being in the workplace.
That's great. And Brian, let me turn to you, because I think, you know, you're a CEO, and leadership really matters, and how people will come forward. I know when we talked earlier, you talked some about the affinity groups that you have at Chipotle and how that might be helping to break down stigma some. Could you tell us a little bit about that and how successful it's been?
Yeah, sure. So we have created some affinity groups here in various areas, and one of them is this group around, it's called Unified. And, you know, the whole idea is it presents an opportunity for people to find others that are dealing with similar challenges, whether it's peers or people that, you know, are leaders in higher positions. And as folks mentioned already, you know, it's just the aspect of having the ability to have a place to talk about it, know that there's no shame in having a place to talk about it, and understanding that there is support for you to get help for whatever you're dealing with that's causing, you know, the stress and or the mental health challenges. So it's been proving to be really powerful. You know, we don't label the group just as a mental health group. We label it more as a unified group under the pretense that everybody wants to come together, include each other, and support each other accordingly. And, you know, it's gotten a lot of positive feedback. And then obviously there's pockets within the group that people then spend their time supporting each other and discussing. And then we bring in external speakers or leaders that have dealt with that issue, either themselves personally or they know somebody. Because I think the biggest piece of the puzzle that we have found here is having people know that, you know, you're not the only one that's ever dealt with this issue. And in the event you're dealing with an issue like this, we want you to get the support necessary for you to, you know, heal accordingly, and not be afraid of, you know, coming forward with what is really holding you back right now. So the idea of creating these affinity groups has proven to be very powerful, and, you know, not all that surprising. It was brought forward by employees. So, you know, folks sent an email, folks reached out as part of, we do these listen in sessions where we talk about what's happening in the company. And it came forward as, hey, it'd be great to have an opportunity to have a group like this, and thought it was a great idea. So we
That's great. And you know, peer support has really proven to be an evidence-based approach. I know the VA and other employers employ those methods, as well as across, you know, I work for the Center of the Future on Aging, where there are a lot of older adults that are particularly feeling lonely or isolated right now through COVID, and their family members as well. So I'm going to switch the conversation a little bit to talk about loneliness during COVID and what we know about some of the negative health impacts of that. Research has linked social isolation and loneliness to higher risk for a variety of physical and mental health conditions: high blood pressure, heart disease, obesity, a weakened immune system, anxiety, depression, cognitive decline, Alzheimer's disease, and even death. A study by Oracle recently found that 75% of people were experiencing social isolation, and this was correlated with working from home. And 7 out of 10 people saying this has been the most stressful year of their working lives. The Milken Institute Center for the Future of Aging will release a report tomorrow called Together Apart: Findings from the Social Isolation Impact Summit. And it helps to remind us that even in difficult times, we must enhance social connection, foster improved health and well-being, and build resilient communities. And the report draws from findings of the National Academies of Science, Engineering, and Medicine's report that came out in February that found the highest rates of loneliness are among people with low incomes, people who are LGBTQ+, and people living alone. Have you all addressed any of these populations specifically or looked at the challenge of loneliness and social isolation during COVID? How much do you think this social isolation is among your workforce or with the veterans you served?
So Nora, we started a program before COVID, but then really scaled it up during COVID. And we built a dashboard at the VA to identify those we thought were most at risk. And certainly social isolation was one of the key criteria that were included in that dashboard. And so the VA initiated a program of outreach to those they thought were at the highest risk. And that's included over 16,000 outreach efforts to date, and that has resulted in about 41,000 appointments. And we agree with you. The more touch points you can create to connect people, the better. We've also launched group therapy sessions via telehealth during COVID, and we have found that to be a very effective tool as well.
Great. Anyone else want to take that one?
Let's see. We completely agree that COVID has strained the relationships, and we tend to be very collaborative, and we have built a culture which requires a lot of human interaction. And we're used to coming into work, and we have a lot of open space in our buildings where people can collaborate and interact. And of course, that came to an abrupt halt in March. And the first thing we did was try to do continuity of operations by facilitating work at home and expanding the bandwidth in our virtual private network and making sure that people at home had the right technology so that they could connect. A lot of what we do is around software and IT technology and coding, which isn't always the most social endeavor. But we've used, Zoom chat, and we've extended what we call our employee resource groups, where cohorts of people with like interests can interact. We have an internal kind of an internet, we call it Prism, which is where we do blogging. We went to a weekly CEO video. I bring guest speakers. We reach out to employees. We actually started a corporate band so that we can play music, and that we actually have a parts under our COVID-19 website where you can, we had one, take a picture out your window and post it on the work site. Just a way to try to connect to employees who are at home with other employees who are working at home, so they had some shared experience. We did the same thing with their coffee cup. Take a picture of your coffee cup, and then there's a place on our prison COVID-19 webpage where you can post your coffee. And many people have these coffee cups have really funny sayings on them, but it was a way for people to stay connected, because we're a value-based organization with a strong culture. And we're worried with so many of our employees, we're probably still 55% of our employees are working from home, that we would lose the culture of the company and the values that have created that culture. So we're trying to use technology to build back the linkages that we lost due to COVID-19.
That's great. At the Milken Institute, we instituted what we called Wednesday wellness sessions, and similar to the experiences that you have, it was really just a nice chance for employees to connect. But we addressed many issues on ways to reduce your stress. Many of them are very low cost, yoga, meditation. We also did some fun things for many of our meetings as we prepared for our global conference, where we dress up certain ways for our Zoom meetings, like you're saying, everybody where they want to go on vacation, since none of us could go on vacation, that kind of thing. So I think, and I want to just give a plug to all of our viewers out there that we do have some 15-minute intervals during our global conference to give people sort of mindfulness checks, where we have yoga sessions, we have virtual training sessions, we have meditation, etc., really trying to practice what we preach here and know that everybody's really stressed right now.
Hey, Nora,
And
just one thing
go ahead,
on
Ryan.
that.
Yes, please.
Yeah, just one thing, which is, a little different for our company, because obviously we have office-based employees, but we also have restaurant employees that were deemed essential workers through all of COVID. And the one thing I can tell you, because I don't want to repeat what's been said, is obviously the folks that have all gone to remote work, they miss the aspect of the culture, the camaraderie. We're doing a lot of the similar things that have been talked about here. The one thing that I would emphasize, though, is as I've gotten out to go visit our teams that are running our restaurants, they are really grateful to be working in the restaurants with their teams. And, obviously it requires social distancing and masks and, heightened levels of hand washing and sanitizing. But the person to person connection is just so valuable. And, all I can tell you is everything that's been said here still doesn't replace the aspect of having people have the opportunity to get together. And, our typical restaurant, it's a team of 35 to 40 folks. And, during any one shift, you could have, 12 to 20 people. And, the value of them being able to still get together, do their job, do it in a safe way, do it in a healthy way. Really, folks are unbelievably grateful. And, they love the opportunity to serve their community. And then also they love the opportunity to keep their team and their culture in place. So it's just, it speaks to the power of, having your values front and center, and then teams supporting that culture and supporting each other. But I think people should know, folks love getting together, whether it's in a restaurant or, in the neighborhood for a picnic. That's, of course, in a safe, healthy way. It's not replaceable. And I know there's been ongoing debates of like, will you always have a remote workforce? And, for us, we'll figure out how to use it because there is some efficiency in it. But when we can get everybody back together in our offices and have everybody in our restaurants, we will be, watching the clock for when we can do that, because it's a tremendous value to have that people connection and the cultural aspect and the development aspect.
Yeah, that's such a good point. And I just want to say, on behalf of the Milken Institute, we're so appreciative of essential workers. People don't often think of folks in restaurants or grocery stores or drugstores as our essential workforce. And we really couldn't be surviving without these folks going to work each and every day, in addition, of course, to our healthcare and long-term care workforce. I did want to just pick up, though, you mentioned we all want to get back to a time where we can be together. But for now, we have been able to use technology. I mean, here we are, first time ever having a Milken Institute Global Conference virtually. And we tried really hard to do it in person. We rescheduled it 3 times and then finally said, we're going to do this virtually. And some of the benefits are we're able to get, great speakers like you that, can just zoom in for an hour rather than fly places. So there are time efficiencies there, but we've also seen a tremendous change in the way we're delivering healthcare services and telehealth services. Deborah, you mentioned a little bit about telehealth moving up at the VA, but can you tell us a little bit about the experience since COVID hit?
Sure, absolutely. So the VA was a leader in telehealth before COVID. We were running about 2,000 video visits a day. That scaled, truly skyrocketed to 37,000 video visits a day, which is what we're running now. And in the area of mental health, we saw a complete flip from about 80% of our visits were face-to-face and 20% were telehealth before COVID. And now 80% of our telemental health visits are telehealth and 20% are face-to-face. And just to give you an idea, in the month of February, so pre-COVID, there were about 40,000 telehealth visits. And in June, that was 905,000 telehealth visits. So Nora, just huge undertaking and tremendous technology scaling, particularly for a large government agency. People just worked tirelessly to put the technology in place, both at the provider level and to help our patients get comfortable with this new medium.
Yeah, the studies I've seen have said, one of the biggest challenges for telehealth pre-COVID was physicians didn't really want to do it, and people, thought that they would rather see their doctor in person, especially older adults were often. But when Medicare opened it up, we saw a great access to people across the country, and once they became more familiar with it, I'm a believer that now that we've let the genie out of the bottle, it's really going to be hard to put it back in. But this has big implications for mental health as well, because as we mentioned, circling back to our discussion on stigma, it can allow you to access doctors that may not be available in your area. It can allow you to do it much more anonymously, through your secure phone and ways. I'm sure both Roger and Brian have had experience now with some of their health benefits and others, your EAP benefits all being done more electronically. Can you talk some about how that culture change has affected your organizations?
Well, it's been revolutionary, and although we now provide, we always had a telehealth, teledoc capability for our employees. Part of our business is we run the electronic healthcare records for the active military, and there was little interest in telemedicine before COVID, and as a result of working with the DHA, the Department of Health Affairs, we've added telehealth to the electronic healthcare capability. So now all the active military can get telehealth appointments. And the problem, and Deborah talked about this earlier, there's always have been some adjudication issues because doctors tend to be licensed by states, and some of the mental or the healthcare advisors and counselors had also been licensed by state, and there has been some changes in those regulations which have facilitated the whole concept of telehealth. I've had a couple of doctor's appointments since COVID, and I think 2/3 of them have been on my iPad, and they have been completely adequate for the problem that I had. And so what it has done is it has created much more access to providers than we had before. I mean, if you're working and you're trying to go see a mental health professional or just a doctor like an orthopedic surgeon, it's a long process. You call, you can't get in, it takes 2 weeks, and you have to take off work. You drive, he's in surgery or she's in surgery, so it's late, and it's sort of like you give up somewhere along the road. And we know that's true because the number of prescriptions that are prescribed in our benefits versus the numbers of prescriptions that are actually filled. And that prescribed to fill ratio has always been historically low because people get frustrated. And we've seen actually the number of prescriptions go down, but the fill rates have gone up. And so we know that teledoc, telehealth, and extending that to mental has significantly improved access to care for all of our people.
That's great. And, Brian, I know when we've talked before, are you all still seeing me? I lost you.
Yes.
Yeah.
Okay, great. So I wanted to ask Brian, I know a lot of your workforce is hourly as well. And, what both Deborah and Roger, raised the awareness that sometimes we don't think about how some people don't have paid leave. So taking time off to go to the doctor really costs them money, and can be very difficult. And our healthcare system to date has been really designed much more around the providers, what's convenient for the doctors and the hospital systems and others there, rather than the patients. And, you have talked some about your menu of options for your hourly workers and how they've been able to take advantage of that. Do you want to share some more about some of the differences you've seen between your hourly and salaried employees and the benefits that they take advantage of?
Yeah, absolutely. And, it is obviously with COVID, we've seen a tremendous move towards the telemedicine trend. But what I would also say is the thing that's been really powerful is what you mentioned earlier. Our hourly employees, when we asked them, why don't you get mental health? Why don't you spend time on that? Why aren't you filling subscriptions? Prescriptions, sorry. Why aren't you, just having the general conversation with the doctor? And a lot of them just came back to, I don't have the time, nor do I want to invest money that way, given where my health or my stated health is. And so what we've really done is we've tried to break it up into almost like an a la carte menu for where you are in your life and what you need. And then, having the ability to do this via an app or a phone call has just really, we've seen an increase in utilization. And then what we also created, because there's a suite of all these different benefits, we created a healthcare concierge. So what happens is you can literally go to this app, you type in kind of, all right, what is my issue that I'm facing? And then it takes you through our benefits so that it points you in the right direction of what to use and how to contact that individual. And for instance, even like in our EAP program around mental health, we've had over 3,000 hours logged year to date in that. And I'm confident if we didn't have the access be so easy from a mobile device where you're taking your lunch break or your break in general, you can tap into these benefits. I don't think we'd have the success. And then all that is similar to some of the statistics Roger was sharing. We saw people getting prescriptions and then never fulfilling them. And now the ability to do that all via apps and telemedicine has really changed. One, I think getting the right prescription, and then two, getting that prescription fulfilled. And then also, obviously, any follow-up conversations need to happen. And what we've definitely seen is, depending where you are in your life, if you're an individual, a family, young, old, you just have different needs. So, we wanted to make financial planning, that's an a la carte benefit that's available to you. If you need the mental health program, that's available to you. If you want the traditional health program, we've got that available to you. If you just want a prescription drug program, we've got that available for you. So it's proving to be very effective because people then feel like, the things that we're supporting from a company standpoint provide them options that then they can participate in that fits their schedule as well as their budget.
That's great. And I do love the idea of thinking about people doing, a little mental health counseling session on their lunch break. I know sometimes I could use that during the day. Isn't
that what a lunch break's supposed to be? Mental.
Yeah.
There you go. That's
moment?
true. That's so true. I want to bring the conversation before we're getting close to the end, but I wanted to bring us back to the topic of leadership because I know, we started talking about the fact that you all are leaders where you are. And I'll turn to you, Roger, because you created a CEO pledge. And, tell me about why you think it's important for leaders to step up on these issues.
Well, our CEO pledge kind of came out of my journey, and there was so much I didn't know when I was first confronted with the drug overdose, and then suicides and mental health are just followed from that. And I thought, well, how many other CEOs who have had good health care, relatively healthy, are unaware of these issues, and maybe more importantly, what they can do about them, how they could change the way they designed their healthcare program for their employees, how they can participate in the community, some of the opportunities to partner with like DEA and frankly the Department of Veterans Affairs to actually make a difference. And as I talked to more and more of the CEOs that I knew, that they were where I was before I got the email from one of our employees. And I thought, the idea of a CEO pledge, all the CEOs I know are committed to the health and well-being of their employees, but many of them didn't have the knowledge, I think, to make the changes necessary to impact the health of the employee base. And so we designed the CEO pledge around education and understanding. And it's got 3 parts. It says, I'm going to, remove the stigma. I'm going to talk about it in public. I'm going to set the tone from the top. I'm going to look at my benefit plans and to make sure that I've tailored the health and welfare benefits to address this. And what we did is we curtailed the length of a prescription that you could have for an opioid substance. So we used to have unlimited time frame, and we cut that down to 2 weeks. And we found out that after 2 weeks, people didn't fill the prescription. And so it kind of led us to believe that there was a lot of unused OxyContin in medicine cabinets. And then the third part of the pledge was really to participate in the wider community and to partner with a lot of the foundations and charitable organizations, the Community Anti-Drug Coalition of America, there's Suicide Prevention Foundation, there's unlimited organizations that CEOs who have resources can partner with to go out into the community and make a difference beyond just their own 4 walls. And it was a wild success. As we've had over 150 CEOs sign it. I get emails almost daily from other CEOs that are asking us, what did you do? How did you implement the change? How did you negotiate with your healthcare provider to re-architect the way some of the healthcare programs worked so we would continue to maintain a high benefit for our employees, but we could get at some of these latent issues around suicide, drug abuse, and mental health.
That's great. And I know, I've been involved with the One Mind initiative that brings together employers, talk about the best practices. That is so important to be sharing these best practices because, as you said, many employers don't know what others are doing. I was reminded when you were speaking about Bank of America and their leadership in this area, and they've been they found that access was a big issue for their employers. So you can provide all these benefits and encourage people to go see a therapist, but then there are no therapists out there. So they've started, working again as a self-insured employer with, making sure there's access to a wide range of mental health professionals in addition to other specialists. And I think those types of actions that employers can learn from each other, what the next step is, like we keep moving the needle to be further down. So we're wrapping up now, and this has been a great discussion. I've learned so much. So I'll just I try to always end, we've talked about depression, suicide, stigma, many of these topics that aren't, easy topics to talk about, and many people are struggling. And so I think, it's important to let people know they're not alone, and really wanted to showcase all of you who are demonstrated leaders in this area. But I like to leave my sessions on a hopeful note. So I'm going to turn to each of you for a rapid fire response to the question, as we were closing out the session, what gives you the most hope for the future? Want to go first, Brian?
Well, look, what gives me a lot of hope is what I kind of mentioned earlier. When I have the opportunity to get out into our restaurants and be out kind of from coast to coast and just about every state here in the United States, despite the challenges people are facing right now, there still is so much optimism that we will get past this, and by people just doing the right thing. We're ultimately going to get to the other side of the challenges of COVID. And then I think the other thing too that I think is also really exciting to see is, and I believe this, is people in general, wake up every morning wanting to do the right thing, not just for themselves, but for others. And I get to see it very often. And I think you see it in the way teams come together, communities come together in really tough times. And, that can go all the way down to, as we talked about earlier, these, affinity groups or ERGs. In the end, even though things are very uncertain right now, I think in general, people want to support each other and they want to have leaders support and be definitive in saying, what is the right thing to do. And in our case, we really focus in on our company's culture and values and then want to take that into the community. So I'm really optimistic about how people are going to come together ultimately to get us through the challenges we have. And then as people become more aware of the mental health challenges, I think more and more people are willing to support each other in those challenges as well.
That's great. And I know that you all are considered a purpose-driven company, which, is evident in what you're putting forward there. Roger, when you think about these issues, what gives you the most hope for the future?
I'm excited. Really, if you look at the past, 9 months or so, we've seen a lot of change, a lot more awareness around mental health issues. We've seen an emergence of technology, telehealth, teledoc. We've really gotten after the stigma. I mean, if you're, home in your basement, you're not worried about stigma, you're worried about getting help. And I think the exciting thing is that as a vaccine becomes more prevalent and we get on the other side of COVID, I think we will have made permanent changes in the way we view, mental health, drug abuse, depression, some of these treatable maladies. And I think we will all be better for it. And we will never go back. We'll never remove the mental health benefit from our healthcare program. The telehealth is never going to go away. And it's going to create an inflection point, which will lead to all of our employees being healthier.
That's great. And, that connection, that mind-body connection, I think all of us are recognizing so much more is really important to the overall health of people. It's not just your physical body, it's really your brain health as well. So Deborah, I started with you and I'm going to finish with you. What gives you the most hope for the future?
Well, Nora, I think it's to see this conversation in the workplace. I think what you had the courage to be out in front and talking about depression, and then the Milken Institute building partnerships around it, the employer coalition, which is now more than 60 strong that we built with Hiring Our Heroes, has actually written a guide around best practices in the workplace and publicly committed to distribute it, not just within their own company, but to all of their partners and the members of their geographic communities in partnership with local chambers of commerce and with our veteran service organizations. And that's a dramatic difference. We could not have imagined several years ago that mental health and mental well-being would be discussed in workplaces of all sizes in all communities across America. And that makes me very hopeful.
That's great. Well, this event has been live streamed. We've been able to reach people all across the globe. So we're hoping sorry, my timer went off, so I know we're really towards the end. We're really hoping that many people hear this message and it gives you hope. And anyone who's struggling, please, look at these examples. We'll continue to share them on the Milken Institute website, as well as these leading employers and federal agencies that are really taking leadership. So I really want to thank you, Roger, Brian, Deborah, for lending your voice and your expertise, and mostly for providing such leadership on this critical issue. It's been great to be with you.
Well, Nora, thank you.
Yeah, thank you, Nora. Thanks, everybody.
Appreciate it.